Neuralgia is a term used to describe severe, sharp, or stabbing pain that occurs along the course of a nerve. This condition results from irritation, damage, or dysfunction of a nerve and can affect various parts of the body. Unlike other types of pain caused by tissue injury or inflammation, neuralgia originates directly from the nervous system itself. It is often chronic, unpredictable, and can significantly affect a person's quality of life. Understanding neuralgia. The human nervous system consists of millions of nerves that transmit signals between the brain, spinal cord, and different parts of the body. These signals help regulate sensation, movement, and various bodily functions. When a nerve becomes injured, compressed, or inflamed, it may send abnormal signals to the brain, which are perceived as pain. This abnormal nerve activity is what characterizes neuralgia. Neuralgia is not a single disease but rather a symptom of an underlying issue affecting nerve function. The pain can be spontaneous, meaning it occurs without a clear trigger, or it can be provoked by touch, movement, or even temperature changes. Types of neuralgia. There are several types of neuralgia, depending on which nerve or nerve group is affected. Trigeminal neuralgia. This is one of the most well-known and severe forms of neuralgia. It affects the trigeminal nerve, which carries sensations from the face to the brain. People with trigeminal neuralgia experience sudden, intense, electric shock-like pain on one side of the face. The pain may be triggered by simple activities such as brushing teeth, eating, or even speaking. Trigeminal neuralgia often affects older adults and may result from blood vessel pressure on the trigeminal nerve or multiple sclerosis. Postherpetic neuralgia. This type occurs as a complication of shingles, herpes zoster, a viral infection caused by the varicella zoster virus. After the shingles rash heals, some people continue to experience burning or stabbing pain in the area where the rash appeared. Postherpetic neuralgia is most common in older adults and can last for months or even years after the initial infection. Occipital neuralgia. This form of neuralgia affects the occipital nerves located at the back of the head. It causes sharp, throbbing pain that radiates from the neck to the scalp and behind the eyes. Occipital neuralgia may result from neck muscle tension, injury, or nerve compression. Glossopharyngeal neuralgia. This rare condition affects the glossopharyngeal nerve, which supplies sensation to the throat, tongue, and ear. The pain episodes are usually brief but excruciating and can be triggered by swallowing, coughing, or talking. Causes and risk factors. Neuralgia can result from a variety of underlying conditions, including nerve compression, due to tumors, cysts, or blood vessels pressing against a nerve. Infections, such as shingles, Lyme disease, or diabetes-related infections. Nerve injury, from trauma, surgery, or dental procedures. Chronic diseases, like diabetes, which can damage nerves over time, diabetic neuropathy. Autoimmune conditions, such as multiple sclerosis that affect the protective covering, myelin sheath, of nerves. Certain factors increase the risk of developing neuralgia, including advanced age, weakened immune system, uncontrolled diabetes, and previous viral infections. Symptoms. The hallmark symptom of neuralgia is sudden, severe pain along the path of a nerve. Other symptoms may include burning, stabbing, or shooting pain. Pain that comes in sudden bursts or waves. Tingling or numbness in the affected area. Muscle weakness, in some cases. Sensitivity to touch or temperature changes. In many cases, even light touch or mild pressure on the skin can trigger intense pain, a symptom known as allodynia. Diagnosis. Diagnosing neuralgia involves a detailed medical history, physical examination, and sometimes specialized tests. Doctors may use MRI or CT scans to detect nerve compression or structural abnormalities. Blood tests can help identify infections or metabolic disorders like diabetes. In cases of trigeminal or postherpetic neuralgia, diagnosis is often based on the patient's symptoms and pain pattern. Treatment options. Treatment of neuralgia focuses on relieving pain and addressing the underlying cause. Common approaches include medications. Anticonvulsants, such as carbamazepine or gabapentin, and antidepressants are often prescribed to calm nerve activity. Pain relievers, including topical creams and patches, may also help reduce discomfort. Nerve blocks. Local anesthetic injections can temporarily relieve pain in affected nerves. Surgery. In cases where medication is ineffective, surgical procedures such as microvascular decompression or nerve ablation may be performed to relieve pressure on the nerve. Physical therapy. Gentle exercises, massage, and heat therapy may help in some types of neuralgia by reducing muscle tension and improving circulation. Alternative therapies. Acupuncture, biofeedback, and relaxation techniques can provide relief for some individuals. Prognosis and prevention. The outlook for neuralgia depends on its cause and severity. Some forms, such as postherpetic neuralgia, may improve over time, while others, like trigeminal neuralgia, can be chronic and recurrent. Early diagnosis and management are essential to prevent worsening pain and nerve damage. Preventive measures include maintaining healthy blood sugar levels, avoiding infections through vaccination, like the shingles vaccine, and protecting the body from injuries that could damage nerves. Conclusion. Neuralgia is a painful and often debilitating nerve disorder that can disrupt daily life. Although it can be challenging to treat, advances in medical therapy, surgical techniques, and pain management strategies have improved outcomes for many patients. With proper care and early intervention, people living with neuralgia can achieve significant relief and maintain a better quality of life.